Orthodentistry Today.
Hello, and welcome to the Orthodentistry Today podcast. I am Dr. Dan Gurman, your host, your moderator, and your guide on this journey into the exciting world where orthodontics enters a collaborative mindset and program with general dentists and pediatric dentists. Like many of you, I've always had a growth mindset and been very ambitious with my learning and practicing our art and our science. Combining that with decades of private practice where I've treated over 30,000 patients in one of the largest private high-fee orthodontic practices in the United States, I've now shifted my focus and all of my energy into this new mission, and that is empowering dentists to confidently deliver orthodontics for their patients. That's the reason why I founded OrthoBrain. It's to provide dentists with all of the tools needed, diagnoses, treatment plans, and expert support from start to finish in order to integrate orthodontics into their practices. This results in faster treatment plans, greater predictability, and continuous support from an entire virtual orthodontic team. We help dentists deliver orthodontics with exceptional care, confidence, and predictability. In our podcast, we're sharing strategies, insights, and innovations from top professionals around the country so that you can take your practice to the next level. Today, I'm very excited because we've got an amazing special guest. Dr. Patti Swaintek-Lamb is a New Jersey Rockstar practicing orthodontist that has a really keen focus on cosmetic dentistry and airway. And I'm not sure if I should say one before the other because they're both vitally important in your practice. She also serves as a clinical faculty member, teaching aesthetic dentistry, sleep dentistry, and much more. Dr. Patti's going to share some of her inspiring journey with us today, and it's going to be filled with pearls that are going to help you elevate your practice. So let's get right into it. Dr. Patti, we are absolutely delighted to have you here. Welcome.
Thanks, Dan. I'm very excited to be here chatting with you today.
Terrific. Patti, I've heard this term holistic, and it's used rather loosely in many different disciplines. And I know that you bring that term into your practice. You use that to describe the way you practice dentistry. And I really think our listeners would benefit from hearing what the word holistic means to you and what it involves within your practice.
Absolutely. So holistic in my world means, how am I going to treat the whole patient, the whole person sitting in front of me? You know, it's not about tooth to tooth. It's not about taking care of just one little thing. It's about listening to everything that patient is saying to you, who's sitting right in front of you, listening, gathering as much information as possible, and offering them full treatment to take care of the whole situation. Whole health is how I like to treat my patients.
It's fascinating because it really is a different kind of mindset than we often have, particularly for folks when they're doing orthodontics. It seems like the trend, and this holds true for general practitioners, pediatric dentists, and especially, dare I say, orthodontists. Being an orthodontist, I can tell you this is a mindset that really was put into our heads as residents, and that is that we really had such a keen focus on making teeth straight and making them fit to perfection, as described by Larry Andrews in the 6 keys of what he called normal occlusion. And what I'm hearing from you is that there's a lot more to orthodontics, and we'll say orthodentistry, than making the teeth straight and fit perfectly.
Absolutely. You know, I think one of the things that my patients really seem to appreciate when we start this whole conversation is when we start to talk about, well, why are your teeth so crowded, right? So many don't ever hear the explanation as to how they got that way. You know, so many patients do have crowded teeth, and it's almost the norm, right, to expect your kids to have some type of orthodontics. But why? You know, when you look at prehistoric man, they had these beautiful broad arches when you look at their skulls from way back.
Right.
and discussing that with the patient, they really appreciate that. And that's how we start every conversation.
It's fascinating. Patty, tell us a little bit about what you see as the genesis of many of these malocclusions and the maladies that are associated with the malocclusions. Tell us about the connection between systemic health and malocclusion and the genesis of it.
So when I sit with my patients and we start this conversation, it's all about, your teeth are crowded, your arches are narrow, plainly because you're not breathing through your nose, right? You're breathing through your mouth, and most of us do too much. We breathe through our mouth way too much, and that's why all of our arches are so narrow. Our teeth are crowded. We have these high vaulted palates, which then cause a deviated septum, right? And makes one thing like the snowball effect. It keeps getting worse. So when we can't breathe through our nose, we drop our mouth open. We're breathing through our mouth. Now the tongue's not lifted up on the palate where it's supposed to be. So many people don't understand. Normal, healthy breathing are lips sealed, tongue on the roof of your mouth, breathing through your nose. The only time we're not breathing through our nose is when we're running from the saber-toothed tiger, right? But when we can't breathe through our nose, we drop our mouth open, the tongue drops down. Now the buccinator, the muscles will push in, cause everything to become very narrow and very crowded. So that's why it's happening. And then the next question is, well, why can't we breathe out of our nose anymore? And we can't breathe out of our nose anymore because of inflammation. Inflammation is the reason. And what causes inflammation is our diet. Refined sugar, all of this processed food. That wasn't what prehistoric man was eating. He was eating, gathering and hunting and eating off the land. And he ate natural food, and it did not cause inflammation. So that's basically, the little conversation we have with every patient when we're trying to have them understand why they're sitting there with these very crowded arches.
It's really fascinating, to validate and put an exclamation mark after what you just said about diet. I've had occasion to teach in Australia and also very far north in Norway, where you start getting close to the Arctic Circle up there. And when I saw photos of folks who made expeditions up to the pole, they found groups of people that were living there without malocclusion. I looked at the dentitions, they were really worn down, but the teeth were perfectly straight. And it really echoed or mirrored what I saw when I went down to parts of Australia and New Zealand, where we had occasion to be able to see what the malocclusions looked like. And they basically didn't exist unless you count some spacing between the teeth. I didn't see crowding. And it was really such a dramatic difference from what we see in modern America. So it sounds like part of your holistic approach is going to be some counseling. Do you provide nutrition counseling? And tell us how you do that.
Yeah, we talk about an anti-inflammatory diet. What to stay away from, things that we should be eating. We want to use our muscles, first of all. So much of what we eat today is cooked and soft. And so when I'm talking to parents about children, helping them to breathe through their nose as much as possible, teaching them proper oral posture. And they can't really do that unless the parent is providing them with food that is not going to cause inflammation, and food that they can use their muscles to develop to make this whole process go the way it's supposed to. So we give a sheet of an anti-inflammatory diet. We say, I know it's impossible maybe to live by this 100%, but if you can cut out what you can cut out and add more natural whole foods, it's only going to be a win-win for you.
That's really fantastic to hear that you take the time to create and deliver the nutritional recipe for healthy living. And I would imagine that anything that decreases inflammation systemically to the point where it helps with breathing probably has some really significant impact on other body systems and organs. So I think that you're probably doing a whole lot more good than than meets the eye. Tell me this, Patti, do you see a difference in the impact that type of nutrition counseling provides an adult versus a child? I mean, it seems intuitive that when a child is able to take on those habits, that it's going to have an impact, given that they still have growth and development left. Tell us, are there limitations in what you see with adults, or are you seeing the same kind of improvement in adults as you do with children?
Well, I think, you only can provide so much information before the patient has to take some responsibility, right?
Yeah.
And the people who are serious about it, they do. I mean, I think all of us can speak from our heart and say, when you're eating healthy, you feel better. Like you absolutely know that, right? Um, unless you're really just not paying attention. But I know off the top of my head, I can tell you when I'm eating well. I know how I feel. I just know I feel less bloated, right? I feel like the gluten, the dairy, all the refined sugar, all the processed foods and wheat. It just causes us to feel sluggish. It makes us stuffy and it makes it hard to breathe through your nose. So, it doesn't take much to give it a little bit of a go and see it, you're going to start feeling better pretty quickly. But it takes a lot of discipline to totally change how you're eating if you're not a healthy eater. So I totally get that. None of us eat perfectly all the time, but I think if you give it a try, you do feel the difference.
Yeah, well, thank you for sharing all that, Patty. If it's okay with you, I'd like to transition a little bit more into occlusion and the teeth aspect of it. I had the opportunity, the privilege to be able to watch you in a webinar, which was really quite fascinating, and everybody ought to watch that. They'll learn abundantly. You made a distinction between a good functional occlusion and that ideal textbook, we'll call it Larry Andrews' 6 keys kind of occlusion. It seems like some of the adult patients, or many of the adult patients that you've shown as examples, the before and afters and the benefits they've achieved, you reference giving them a good functional occlusion. Can you talk a little bit about the difference between the textbook occlusion and a good functional occlusion, and the thinking behind that with your adult patients?
Sure. If there is one thing that kept me from venturing into the orthodontic world earlier in my career, it would be this textbook occlusion that I was afraid that I could never make that happen for my patients because it was so specific. And
Mhm.
if you didn't achieve that for your patients, the case was a failure.
Right.
That was
Mhm.
that's the understanding I had of orthodontics when I was coming up early in my education. But then as I started to get into it, and how I got into orthodontics was just because when my children became of the orthodontic age, I knew that they needed to be breathing better, and I wasn't getting answers from our my local colleagues about that. And I just felt like I had to educate myself, and I did. And I just took course after course on airway and ortho, and I started to do it myself. And what I learned from these mentors of mine was this doesn't have to be textbook. This has to be better than what they had, and this has to improve their overall well being in some sort. Guess what? Breathing trumps a bad occlusion. You need to be able to breathe, right? And I think on that webinar, you saw a little bit of a video testimonial of a patient who came in. He literally was at his wits' end. And by expanding him and getting him into a little bit more of creating more room for his tongue, decompressing his joint a little bit, and just by doing this a little bit, it made all the difference in this man's world. He was able to function, he was out of pain, he was breathing much better. So maybe his occlusion isn't perfect. It wouldn't pass maybe a board certification, but first of all, it looks beautiful. His smile is beautiful. And this man is over the moon on how much healthier he feels. He's out of pain and he's sleeping better. So in my world, that's a win.
You know what? I've been accused of being FOS, just between two friends here. The truth is it's full of sugar. I'm going to prove to you that I watched the webinar. He's 58 years old. He used to be a runner, right? Is that the right
Good
one?
job. Thanks for
Yeah.
actually watching, Dan.
I actually watched and listened to every word, and it really opened my eyes as to how powerful this can be. So, you use the word, or we talk about an ideal occlusion, and we talk about a normal occlusion, we talk about a perfect occlusion. I think for anybody who is an orthodontist, that is any dentist doing orthodontics, whether they're an orthodontist, a pediatric dentist, a general dentist, if you're doing orthodontics and you have a holistic mindset where you're taking a circumspect look at your patient, it's worth reading The Six Keys of Normal Occlusion, written by Larry Andrews, a true genius from orthodontics. And here's the article was published in 1972. And so it's a classic, and everybody has to read it that goes through orthodontic residency, and all of us should read it. It isn't perfect because he refers to normal occlusion, but I think what he really means is an ideal occlusion, because normal is what most of us have, and most of us don't have what he describes inside the article. It's almost something that we pursue. And I think what you're saying is that you don't pursue that at the expense of somebody's ability to breathe, that somebody's systemic health, their longevity depends upon it. I mean, the work that you're doing, Dr. Patti, in your practice by treating people, it's not what you're doing to them, it's what you're doing for them. And you're actually extending their lives. I mean, they are going to live healthier and longer lives by enabling them to breathe. And so I take my hat off to you for figuring that out. And it's all predicated on the fact that teeth aren't smart, and they don't know whether they're class 1, class 2, or class 3. They just feel the forces. And if the forces are loaded vertically, they're probably going to be okay. And if you don't have big interferences with your movements, they're going to be okay. And that's what you've seen in your practice. Has that been your experience?
Yeah, absolutely. And like you said, it's not like we're not trying for that ideal occlusion, because you absolutely do try. But, if something has to give here or there, maybe that's okay, because as long as you can create more room for their tongue, decompress their joint just a little bit to help them with that, any kind of pain and discomfort, those things really make a difference. And I will tell you, I have learned this just by doing. If you do it once, you can do it again. Some cases can be much trickier, but I definitely believe now I'm much more confident when a patient sits in my chair and they're suffering from TMD and they're suffering from airway issues. I certainly have so much more confidence today that I can help this patient. Maybe I can't take them to 100%, but can I take them to 50, 75, 85, 90, sometimes even more? But as long as you can help them feel better in some regards, patients, they appreciate that more than they can say.
Well, it sounds like a beautiful way to create raving fans. You're helping people, like that 58-year-old gentleman. You helped him regain his ability to get out there and run and to start to resume the life that he had been accustomed to, as improving his health. And the side effect of that is having a beautiful smile, right? Which is
Absolutely. It's a nice
perfect.
cherry on top of the cake, right?
It is, and it's a great segue into, we'll call it cosmetic or aesthetic dentistry. There's been this term that's been thrown around where we've heard it. I know with a previous podcast, Dr. Wes Mullins, the dental guy, mentions that he has this ortho first mindset, and he's like-minded in that he really is looking at aesthetics, and airway dentistry is top of mind for him. Tell us a little bit about whether or not you have differences in the way that you're looking at your patients that come in that are asymptomatic, seeking a more aesthetic smile, versus those who have some medical challenges and are looking for some improvements in their health, and then maybe even with children. How are you looking at them differently? Those different segments of your orthodontic population.
Hmm. Yeah, if a patient isn't really complaining of pain or any kind of symptoms, really, and I'm not very concerned that I see any red flags there, and we're looking at more of a aesthetic solution. In the past, where I used to do that with just restorations, whether it be veneers or whatever we were thinking of. Now I'm like, let's put those teeth where they should be so we can reduce them a whole lot less than we're going to have to reduce them now. Because nobody really wants that, right? Nobody wants to lose more tooth structure than they have to. So when I explained to them, listen, if we put you in clear aligner therapy and we put you in a position where I will have to reduce much less tooth structure, it's going to be just a better experience for you. And it makes me feel really good to have to reduce less tooth structure. There's no doubt about that.
Yeah, that's terrific. I've been the beneficiary of seeing you teach aesthetic dentistry, and I've had this question that I'm going to ask you while we're recording here, so our listeners can understand your workflow as well. When you're doing a combined, say, ortho, whether it's with or without airway challenges, with or without TMD challenges, regardless of why you're doing the ortho and aesthetic dentistry, you've used this product and service called Trial Smile. When you're going to use a Trial Smile on one of those combined treatments, do you typically do the Trial Smile before you start treatment, or do you do it after the ortho and before the aesthetics? And the reason, while you're formulating your answer, I'm sure you already know it, but just to give you another few seconds, I know we've done some ortho for our orthodontists in OrthoBrain, and sometimes they wish they could expand more than they expanded. In other words, you're looking at the buccal corridor, and you can only widen the teeth as far as the jaws will allow. And I know you've given some of your treatment protocols of expanding slowly to help protect the periodontium and supporting structures, all the periodontal architecture. But nevertheless, there's some limit. And I know for some of them, after doing the orthodontic expansion, helping the airway, rounding out the arches, minimizing the enamel reduction, some of those patients have benefited from having the veneers on their premolars as well as the anteriors. Talk to us a little bit about the timing and how you use a Trial Smile in a situation like that.
That's a very good question. So when I see that their arch form is going to be so compromised that maybe number 8 or 9 is sticking way out of the arch form, I'm going to tell them, we can do a Trial Smile, and it's really going to give you a good sense of what we can accomplish here with doing restorations, porcelain restorations. But it's going to be much better if we can do the clear aligner therapy first, and then because we could get the expansion we need, put the teeth where they need to be, and then move on to the restorations. So I will do it first. In most cases, I will do the Trial Smile before we even do the clear aligner therapy, because by doing the wax up, I can broaden those corridors, like you said, and it's going to look so much better than it looks now. And the only issue is if, let's say, that tooth is sticking out, I say, we're going to have to just pretend that's not the situation, because we're going to move that into the correct position. But many times it does give them the motivation to say, oh my gosh, yes, I want that kind of smile. So yes, let's go on to the clear aligner therapy. And then sometimes I've done it where I've done another Trial Smile after that. That's usually how we time it.
Fantastic. Thank you for sharing that. And I'd like you to go just a tiny bit deeper. I think the assumption is that all of our listeners know what a Trial Smile is.
Sure.
Can you tell them a little bit about what it is and how they're able to get one if they want to go in that direction and use that modality?
What we call a Trial Smile, some people may call a cosmetic mock-up, but what we do with it and how it's a little bit different is we'll have, whether you do it yourself or you have your lab technician do your wax up. After we do the wax up, then we make a matrix of that wax up. So we have a putty matrix of it, and then we'll have the patient come in for an appointment, and I tell them it's like taking the race car out for a spin to see if you like how it drives, right? Let's have you sit down. Let's try this in. I use like a temporary material, and I try to stay a nice bright color, and I fill the matrix with the material. The Luxa Temp is what I typically use. And then we place it and let it sit for about a minute and a half, and we wipe away the excess. And then as we peel that away, the temporary material stays on the teeth, and they get, like I say, it's that test drive. People are blown out of the water when they see how good they can look. And even for people who are kind of skeptical, they're like, I don't know if I really want to do that. If you let them see what this looks like, and then we take photographs and we put it up on a big screen right in front of them, and then we also print out copies of it. We give it to them to take home. We email it to them, so they, everywhere they go, they can see how good they look before and after. And it's a great way for a patient to really see what they can achieve with their smile.
I've been able to bear witness to that whole process of patient being scanned and then having the trial smile placed. I've seen what Dental Ceramics from Richfield, Ohio is doing for folks when they have those trial smiles made. Knocks my socks off. And I've actually seen patients go to tears where they say, you can do that for me? My teeth can look like that. And, you know, you pass the Kleenex. It's really quite a great educational tool. And I think with orthodontics, when you're doing orthodentistry, the way we communicate with our patients in order to share the story, whether it's our hygienists that are communicating with patients about the opportunity that they have for some of their problems that are picked up during their hygiene appointments, those communication skills are really requisite in order to bring this into your practice and avail your patients of all these opportunities. So with that, I wanted to go into this whole area of how you came about finding OrthoBrain to help you with your orthodontics and why you like to do it yourself in your practice rather than referring. There must be some sort of story in there as to what brought you to having orthodontics within your practice.
Sure. Those are two great questions. I'm going to start off with your first one, though, which was how I found OrthoBrain, and how lucky am I that I found OrthoBrain. But so as you said, I'm a clinical instructor in Richfield, Ohio at Dental Ceramics. And luckily they share space with you. So I was able to get to meet your entire team, and I was able to hear you speak. So I was doing a lot of clear aligner therapy treatment then, and I was a little skeptical. I'm like, let me see what they're all about. But I spent time talking to everyone in your group. I went home and I tried a few cases, and I thought, this plastic is awesome. There is no reason why I shouldn't be using this plastic. And the communication between the doctor and you have an orthodontist who's actually helping you with that case. And no matter how much experience you have, to have someone to collaborate with is such a gift. And I have become good friends with Dr. Jones. He's so helpful to me in my cases, and I appreciate how eager he is to help me with those cases. So I've been doing these cases. I've been only doing OrthoBrain now, and I just love how the cases turn out. I love my communication and the collaboration. And I have to be honest, the price point is really, really good. I mean, talk about being predictable and being a economic factor in your overhead. It's really significant. So it's a win-win as far as OrthoBrain goes. You asked me then how I started to incorporate ortho into my practice, and I kind of touched on it earlier. When my kids were of age to start the orthodontic process, I didn't love how things were going, and I started to learn more. And I actually brought an orthodontist friend of mine out to Richfield, Ohio, to hear an orthodontist speak about airway. That was 20 years ago, I bet. But anyway, the orthodontist was like, nope, I don't believe that. Why would I, he said to me, why would we change how we do things for the last 100 years? And I was like, gosh, if I was doing this dentistry the same way I was doing it 100 years ago, are you kidding me? But anyway, he obviously wasn't of the same mindset. So I was like, darn, now I'm going to have to learn to do this myself. So I started taking courses, and I was doing orthodontics. I was doing a lot of functional expansion with functional expanders, but then I had to learn how to put brackets and wires on. And that was really time consuming for me. I loved it. I loved seeing what I could achieve, but it took me a long time as a general dentist to do that. Now, what you've developed here with OrthoBrain is a great way to go into the world of brackets and wires if that's what you need to do for a case. But having said that, soon I started to transition into how can I make my ortho world, my airway orthodontic world, how can I translate that into clear aligner therapy? I wasn't sure it could work, but I just started doing these cases. I do have a mentor. I will say Ben Moralia is someone who has helped me bridge the gap between clear aligner therapy and airway. And basically the number one thing he taught me was when you're planning your clear aligner therapy case, just keep in mind the same thing you were doing with your brackets and wires, and just be very verbal on your clean check or on your message saying what you want to achieve. And it started to work for me very well. And I loved what it was doing, so much so that clear aligner therapy has become such a huge part of what I do. I can't imagine ever not incorporating it into your practice. It's a game changer as far as my career has been.
That's fantastic to hear. I'm so glad that you and your practice have embraced Simply Clear. As you know, we are our company, Simply Clear, powered by OrthoBrain. We are dentists working for dentists, which is probably one of the reasons why you feel so good about some of the ways that you're able to purchase and partner with us. And it makes me smile because, here you're developing a relationship, even though you meet the orthodontist on video. So when Dr. Jones reviews all your records and he's going through your photos, x-rays, and STL files and talking to you about your aligner design, the fact that he's speaking to you and you see him seems to be building this relationship. And then I know you interact with each other with our communication portal as well.
Yeah.
When you meet him in person, you'll love him even more.
Yeah, we can't wait to do that.
Yeah, our orthodontists are really phenomenal. I mean, everybody on our team is. Tell us a little bit about what it was like to switch from the aligner vendor that you were using previously, or I'll say vendors, the ones that you've worked with, as you switched to Simply Clear. The reason I ask you that is I sense that some people, some practices may have some members on their team that are afraid to switch. Wow, I already have my computer knows my computer's already memorized my login credentials. I'm afraid I don't want to make a change. What was your experience like? And is there any advice you have for our listeners about those who are contemplating a change?
It was not even a hiccup. There was really not a problem whatsoever. We started using the OrthoBrain portal, and it really hasn't been a problem. I think the passwords might be the same that I use with the other companies. It's just a very simple transition. One of the things I recommend, and my team has gotten very good at it, is just start using the words clear aligner therapy. Like, stop saying Kleenex, start using tissues, right? We just want to talk about clear aligner therapy. It's the tool. You don't need the name brand of whatever your old company used to be. Start using clear aligner therapy. It's not a hard transition to move into the world of OrthoBrain or Simply Clear. They make it very easy for you to do. Your reps are any question you may have. I call Gino, who has been my rep, and now, luckily, now you have someone closer to me, which is good too. But you have a question, I text those guys. They are on it like that. I mean, there's not a thing they won't do to make your life easier, honestly.
Well, thanks for sharing that. And I think that really goes to the heart of the culture that we build in the company, and that is dentists working on behalf of dentists, and our teams very much mirror what you have in your practice, and the way you care for patients. I mean, each one of them is a precious person. What I'd like to hear from you now is a little bit more about you. You probably have gotten this sense that I kind of do things upside down and backwards. Typically, a podcast will start out with, okay, you're going to meet Dr. Patti. She went to school here, 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 and here, and she got this ribbon and this award and all those kinds of things. People are much more interested in you once you have fascinated them and built your credibility as the rock star I said you are. And so at this point, folks want to know a little bit more about you. And I think that they realize that you're in private practice. They already know that you're a clinical faculty member for cosmetic dentistry and for airway. They may not be aware that you've won this award for being an outstanding contributor to the residency programs that you've taught in. Tell us, what always fascinates me is, what is it that you have done that really made your parents proud?
I love that question, Dan. What I have done to make my parents proud, that's a good question. There's just no doubt if my parents, and they've been gone now for several years, but if my parents were around now, well, first of all, they'd be thrilled to be listening to this little podcast, but they were my biggest cheerleaders, as many of our parents are, of course. But, when I didn't believe I was going to go to dental school, although part of me really wanted to do it, I was afraid about the financial aspect of it. And my mother just said to me, if you want this, if you can see yourself doing this, we will make it happen. And she stood by those words 110%. And if she could see she was with me when I bought my practice. It was a 2-chair, 800 square foot practice. I bought it when I was, I think, 28, maybe had just turned 29 years old. So my husband and I just got married, and before we bought a house, we bought the practice. So I have a husband who's so supportive of all of this. He's not in dentistry, but very supportive. And we've built that practice now to 6 chairs, 2,000 square feet. And this coming February, next month, will be my 30th anniversary of buying that practice. I bought it February of 1995. And if my mom and dad were around to see that it has grown to be what it is today, they would be so proud. And the fact that dentistry is such a great profession, especially when you can keep adding services like clear aligner therapy, right? It just opens up the world of what you can offer your patients. Your patients don't want to go anywhere else. They want you to treat them. So it's so beneficial for the patient. It's so beneficial for your overall practice and what you can do for your patients. So my parents would be thrilled. Just the fact that I've worked for those 30 years. I've had 3 kids. I've never really taken any time off other than a couple of weeks after I had each of my babies. But yeah, my mom would, especially my mom, she was my cheerleader, and they'd be thrilled to see where we were today.
Well, congratulations on that. You have given your parents the greatest gift you can possibly give them, and that is to give affirmation that they did something right as they were raising you. Congrats on the 30 years. I believe that you, like me, we haven't peaked yet. The best is yet to come. And for all of the young dentists that are our viewers, keep in mind, you are now just entering the golden age of dentistry. This is the golden age. Not when we got started. I started way before you did, but that wasn't the golden age. The golden age is right now. You have, with the digital revolution, so many additional tools at your disposal to be able to deliver amazing care for your patients and for their systemic health. Dr. Patti, before we conclude, is there anything else that you'd like to share with our audience?
There are 3 quick points I want to state. Number 1, as a dentist, you should be taking photographs on every single patient, because if you could take a full series of photographs and put those pictures up in front of your patient, it is so easy to get them to say, yes, I want clear aligner therapy. Absolutely. So if you're not taking photographs, please learn how to do that as soon as possible. Number 2 is take a scan on every new patient, and actually every patient once a year is our new policy in our office. That way, a lot of times they'll come back to me and make a phone call and say, you know what, I want that clear aligner therapy after all. So now they don't have to come back. I just send it off. I have everything I need. That's number 2. And number 3 is, this is this is the sweet spot of dentistry. I feel like I'm my sweet spot right now. If you're not excited about being a dentist right now, there is so much that you should be excited about, and your relationship with ortho brain should be one of them. So those are my statements that I wanted to end with, and I'm really happy to have spent this time with you here today, Dan.
Dr. Patti, thank you so much for sharing all that valuable information with us. That was fascinating. I learned abundantly, and I love the way you were able to fold holistic dentistry into your practice, because dentistry is about so much more than the teeth. It's about providing comprehensive care for our precious patients. And yes, each one of them is precious, just like orthodontics is about so much more than plastic. Yes, the plastic we use is premium, but the secret sauce is in providing all of the support you need from start to finish, including a diagnosis, a treatment plan, informed consent. All those things are what make all of this so unbelievably successful. So thank you so much for joining us on Orthodentistry Today. Remember to subscribe, to leave a review, and please share this with a colleague.